I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Myself, Dr. Sujit Ghosh from channel Dr. Ghosh Presents. You know, I am doing for last more than 1 year videos on homeopathy. There are 4 different playlists. Homeopathic therapeutics in Bangla, homeopathic therapeutics in English, homeopathic remedy picture in Bangla, homeopathic remedy picture in English. Now actually what I want to say is that you will get about 12 to 1300 videos on this subject. Top 10 homeopathic remedies for meteoragia. What is meteoragia? Meteoragia is heavy, prolonged and or irregular bleeding from uterus unrelated to menstruation. How common is meteoragia? Meteoragia is not reported by all who suffer owing to social taboo. It is estimated that about 15 to 35% of women worldwide suffer from meteoragia. However, actual number may be higher. What are causes of meteoragia? Causes of meteoragia vary widely, including mental conditions too. Related to abnormal growth, fibroid, polyps, adenomyosis. That is, all these 3 are abnormal growth and leads to meteoragia. Infections like cervicitis, gonorrhea, chlamydia, trichomoniasis, endometritis, etc. Due to imbalance in hormones, polycystic ovarian syndrome, PCOS, polycystic ovarian syndrome, thyroid problems, anovulation, malignancies like endometrial hyperplasia, cancer of ovary, cervix and vagina, miscellaneous medical conditions like pelvic inflammatory disease, diseases of liver, kidney, etc., leukemia, injury and intrauterine device. Intrauterine device actually some sort of mechanical intervention placed in the uterus. This is the thing actually. This is called T. This is a part of IUD. This is placed in the uterus for stopping of K, this fertilization. That is a mechanical procedure to stop fertilization. So these are the so many causes of meteoragia. So many causes. Here it is. These are just first point, that is fibroids. This is polyps. This is fibroids. Uterine fibroid. This is polyps. This is adenomyosis. Adenomyosis is a very interesting thing. Adenomyosis means we all know that the endometrium of the uterus, with every month the endometrium just falls off, creating menstruation, and in the next phase again this endometrium develops. Now this endometrial tissue sometimes moves from this place to elsewhere, say from this place to body of the uterus, here. Then what happens when this menstruation, during menstruation, this hyperplasia of this endometrial cell happens, these cells also acts like that. That is, they are also inflamed, and when it bleeds, they also bleeds, but it is within this structure. So it is very much painful and abnormal menstruation. So this is adenomyosis, very uncommon type of diseases. All other are common diseases. What tests are usually conducted to diagnose meteoragia? Any of the following tests are conducted to arrive at a diagnosis: thyroid tests, blood tests, hormonal level tests, pregnancy test, examination of uterus, hysteroscopy, ultrasonography of pelvis, endometrial biopsy. So many tests are there. Depending on the position, depending on the situation of the lady, the tests are done and diagnosis is arrived at.
How can one prevent meteorrhagia? It is very difficult to prevent meteorrhagia in toto. However, following three approaches may reduce the chance. Practicing safer sex, maintaining healthy body weight, avoiding foods with high animal protein. Food with high animal protein actually causes cancer. Maintaining heavy body weight, healthy body weight, extra body weight leads to hormonal troubles, that is meteorrhagia. Practicing safer sex also the same thing. There will be some trouble if the sex is unsafe, and this may lead to meteorrhagia. Now we have come to remedy portion. Hydrostenum mure for meteorrhagia. Profuse incessant bleeding. No remedies prove efficacious. Start with 1x too early. When bleeding ceases or rather reduces, use 3x 4 hourly to cure. Hydrostenum mure is a very effective remedy for acute meteorrhagia. Sabina for meteorrhagia. Fatty ladies, profuse bright red intermittent bleeding during menopause or pregnancy or after parturition with pain in back or abdomen. Flow reduces during walking or standing. Sabina 3, use Sabina 3 4 hourly. Calcarea card for meteorrhagia. Fat, flabby, anemic ladies suffering from frequent profuse bleeding with cold, wet feet. Due to fibroids or polyps, give 30, calcarea of 30 4 hourly. MAC curve for meteorrhagia. Meteorrhagia of rheumatic origin, profuse bleeding mainly at night. Use 3, MAC curve 3 3 hourly. Arsenicum alb for meteorrhagia. Too weak, extremely tired due to huge protracted uterine bleeding, burning all over the body, yet looking for heat. Use 3 4 hourly. That is arsenic 3 4 hourly. China for meteorrhagia, profuse bleeding with pain, desire too strong, desire means sex desire, bloody leukorrhea, much pain in pelvis. Give 6 China or 30 4 hourly. Ambraghesia for meteorrhagia, nocturnal meteorrhagia with profuse bluish leukorrhea, worse at night. From slight cause, bleeding occurs. Give Ambraghesia 3 4 hourly. Pyramid for meteorrhagia, for weakly anemic chlorotic ladies, discharges of long pieces, too early, too profuse, too long lasting, pale, watery bleeding. If patients suffer from iron deficiency anemia, give material dose, that is lower dose, 1x, 2x trituration, 3 to 4 grain, say 4 hourly or 3 hourly. Else, that is, if there is not iron deficiency anemia, some apparent type of anemia, then give higher potency. Crocus, Crocus sativus sat for meteorrhagia, used during active phase, tarry black like long ropes, that is the bleeding, the look of the bleeding, tarry black like long ropes, huge, slippery. Worse from least motion, painless bleeding, use Crocus sativa 3 4 hourly. Sickle core for meteorrhagia, for cachectic ladies, dark fluid like blood, cannot tolerate heat, crave coldness, burning in uterus, irregular flow continues from one period to the next. That is between the two periods, the whole period, between the two menstrual period, the total period, bleeding continues, irregular flow continues. Give 1, that is sickle core 1 4 hourly. With this, the video ends. Thanks for listening and viewing. Any problem, write down in the comment section. I would certainly attend. What are signs What are signs and symptoms of leprosy? Reddening, inflammation, ulceration of skin with no response to anti-inflammatory drugs. Leonine face. Leonine means face, like is lion. This is like this is a brows, creases on the forehead and other things. This is called lionic faces. Leonine face. Clubbing of fingers. The fingers, top head of the fingers are clubbed. Spade-like appearance of the claw. The claw is like a spade, and claw-like appearance of fingers. The fingers are like a claw. Weakness of muscles, numbness in fingers, hand, feet and legs with decreased sensation of touch, heat and pain. These are the classical symptoms of leprosy. How does leprosy spread? Leprosy is not actually contagious. It's not acutely contagious. It's contagious, highly contagious, but not acutely contagious. It spreads through droplet infection of mucosal secretion of an infected person. Close and long contact of an infected person is necessary to spread the disease. The disease is slow to develop. Incubation period is as long as 5 years, as it is said by World Health Organization, and highly resistant to treatment with ordinary remedies. Symptoms may not appear as long as 20 years. That is, one may require 20 years to symptom to come. Who classified leprosy? Depending on the type and number of affected skin areas, WHO classified leprosy into two types. Number one, paucibacillary. Lesions less than or equal to 5. Lesions means wounds, that is skin affection. Less than or equal to 5. No bacterium detected on the skin. Multibacillary. Lesions more than 5 and or bacteria detected on skin.